I'm Dr. Peter Glidden. This is my Healthy Bone and Joint webinar redo for April 2014. Bear with me. Very, very good. Let's put it into first gear and see where we go. Now, we're going to talk about arthritis tonight. We're going to be talking about a lot of different things relative to bone and joints, right? But this is encapsulated best with the term arthritis, which everybody has heard. It may interest you to know that arthritis is a perfect example of fancy schmancy Latin doctor talk designed to make you, the patient, feel intellectually inferior. Arthritis is Latin for inflammation in the joint, right? So what do? You've got inflammation in your joints. You know that you've got inflammation in your joints. You know that you've got pain in the joints. You run to the MD's office because it's the only medicine that's legally allowed to be practiced in your state that your medical insurance pays for. It's the only medicine they've taught you about. It's the only medicine you know anything about. And the MD does $3,000 of diagnostic discovery and tells you that you have arthritis, which is Latin for inflammation of the joint. You already knew that before you went into their office, and then they're more than happy to give you medications, the intention of which is not to cure the arthritis. The intention of which is to manage your symptoms. Now, I'm often criticized for being too harsh on the MDs and for having MD bashing sessions, and that's not what this is at all. This is about perspective, gaining perspective on the delivery of medicine all around the world so that you can understand whom you should bring your body to for the best possible outcome. We don't have this type of education, this type of knowledge, this type of understanding, because for the last 100 years, all that we've known about is MD-directed medicine, MD-directed medicine, MD-directed medicine, MD-directed medicine. So drugs and surgery are wonderful when they're applied efficiently and effectively. And in fact, that is the domain of the MD. The MD is best trained for a surgery when it's absolutely necessary, a handful of infectious diseases, and trauma care. But when we let the MDs start to get their hands on an arthritic condition or a bone and a joint condition, it's bad. You know, facts are a stubborn thing. While we have given ourselves over exclusively to the care of the MDs in the United States, 46 million adults have some form of arthritis. By 2030, that's 16 years from now, 67 million Americans aged 18 or older. I bet you thought arthritis was a geriatric illness. Not so much. By 2030, 67 million Americans are projected to have some type of arthritis. 2/3. Here's a startling statistic. 2/3 of the people that have arthritis are under the age of 65. Now, this is an interesting pitch. This is an interesting pitch. You'll read this all the time, by the way. Front page of USA Today, front page of the Wall Street Journal, front page of the New York Times, right? In 2003, arthritis cost the U.S. economy $128 billion. Well, that's correct. But if it's costing somebody something, somebody else is profiting something. So you never read the headline. Orthopedic doctors made a killing this year. They profited $128 billion on the backs of your suffering. It's good to be an orthopedic doctor. You never hear it pitched to you that way. But that is, in fact, a fact. While we have given ourselves over to exclusive disease management by the allopathically trained MDs, the arthritic statistics have not budged. Actually, more and more and more people are getting arthritis. Now, if this were a genetic illness, then didn't Gregor Mendel, didn't Charles Darwin argue for the survival of the fittest? If arthritis was genetic, as the MDs will tell you that it is, wouldn't a rational person make the assumption that there should be less and less and less and less of it every generation? Because aren't the weak genes supposed to be deselected from the herd? Arthritis is not genetic. And anybody that's told you arthritis has genetic roots, if they're a medical professional, should have their medical license revoked. It's the second most frequently reported chronic condition in the United States, and this, I'm assuming, is not any different in any other industrialized nation. Now, the MDs are trained to believe that your body does not have the ability to fix itself, that once you're sick, you're screwed, and your only option is to let the MD manage your symptoms with drugs until they get so bad that you need surgery. This is the philosophical orientation which informs all of the MD's treatments. I mean, think about heartburn. Does your medical doctor not know how to cure heartburn? No. They know how to manage heartburn with the little purple pill, but they can't cure it. Nor can they cure any chronic disease. It's not the job of the MD to cure it, nor is it the job of the MD to understand what's causing the illness. It's the job of the MD to manage your symptoms with drugs until it's so bad that you need an operation. Bad for you, good for them. This data just released 2 days ago by Medicare in the United States. They listed the salaries of all of the different physicians in the United States, the money that they pay different physicians in the United States. At the top of the food chain, orthopedic surgeons. The annual salary in the United States, if you're an orthopedic doctor doing knee replacement, joint replacement surgery, $475, it's $500,000. It's good to be a joint repair specialist. Good for their pocketbook, not so good for you, because interestingly enough, statistics are a stubborn thing. Now, there are many different types of arthritis. Now remember, the MDs are excellent at naming and categorizing things, but they're horrible at figuring out how to fix them. So over the last 100 years, they have categorized many different types of the arthritic condition. There's rheumatoid arthritis, where they tell you your body's developed antibodies against itself, which is nonsense. They'll tell you there's psoriatic arthritis, there's traumatic arthritis, there's degenerative osteoarthritis, etc., etc., etc. And they're correct. You can categorize and subcategorize and delineate and draw parameters around this presentation of the illness and this presentation of the illness ad infinitum. But keep in mind, your MD may be the nicest human being ever to walk God's green earth. But by virtue of their training, by virtue of their philosophical orientation, about the relationship between the human body and disease, they have no earthly idea whatsoever about what causes arthritis. None whatsoever. It's not their thing to understand that. It's their thing to deliver drugs to manage the symptom. Now look, I can prescribe drugs. I'm not against drugs. Thank God for Novocaine. Thank God for morphine. Thank God for penicillin. It's not the drug, it's how it's used. It's not the gun, it's how it's used. The way that MDs use drugs, it's the leading cause of death in the United States. So when you present your body to MD with any type of bone or a joint issue, the MD's treatment protocol is this. They'll give you anti-inflammatory meds and pain meds. Then they'll give you surgery. Then they'll give you more pain meds. Then they'll give you more anti-inflammatory meds. And then they give you more surgery. I've had patients that have had 4 different knee operations on the same knee. Now, we must not overlook the obvious. All you have to do is follow the money. $128 billion a year is given to the MDs who treat arthritis, but they don't have any intention, know-how, knowledge, or understanding of how to cure it. It's good to be an orthopedic surgeon. Like the fella said, when all you have is a hammer, everything looks like a nail. When all you have is an axe, all you want to do is cut things down. We need perspective, ladies and gentlemen, because we do not have any. And we are up against it, and we are up against it hard. The statistics are startling. The arthritic condition is getting worse and worse and worse and worse and worse, and it starts in the teenage years. And if we don't do something about it, well, that's why we're here, to do something about it. By the way, with my MD colleagues, cousins, it's all about research and double-blind this and double-blind that, and let's prove it with some type of double-blinded, placebo-controlled clinical study, right? Well, that's only good as long as it doesn't go against the grain. According to the Journal of the American Medical Association in July 2002, that's 12 years ago, knee replacement surgery for osteoarthritis doesn't work. This was published in the Journal of the American Medical Association. It doesn't work. It's a temporary fix at best. Now, if you don't believe me, just ask yourself, how many people do you know that have a prosthetic knee, a prosthetic hip, a prosthetic elbow, a prosthetic shoulder who feel great 3 years, 4 years after the surgery? How are they doing? Not that great. Because the joint replacement does not fix the cause of the illness. Period. Joint replacement for most types of arthritis is like painting over the mold in the basement without addressing the cause of the mold. Well, you can't see it anymore. Can't smell it anymore. Good job, boys. Let's go home and buy a Porsche. Only a matter of time until there's more mold. Last time I looked, that was called quackery. Promoting expensive medical treatments that do not work. By the way, this doctor is performing a CAT scan. Now, here's what we need to talk about. We're going to leave all the doom and gloom behind now. We're going to get into the meat and potatoes of the holistic wisdom concerning the pathogenesis of bone and joint trouble and what to do to support and promote your body's ability to fix itself. Nutrify the joints. Feed the body the nutrition that the joints need to maintain their structural integrity. There's a good idea. Remove inflammatory agents from the diet. Most, if not all, inflammatory agents that enter the body enter through your food and drink, which is scientific jargon for you're eating stuff that's causing inflammation and you don't even know it. You need to stop it. I mean, if you had a little fire going in your backyard, right? You know, you had a barbecue and you dumped the coals over and now you're trying to put the coals out. Would you do that with gasoline? No. Gasoline makes the fire worse. Well, there are 10 foods, which we're going to talk about later, 10 foods, which if you eat them, cause inflammation. And if you have any type of an itis anywhere in your body, even if it's not arthritis, any type of an itis, the consumption of these foods will promote inflammation. It's like rubbing salt into a wound, and it's not a good idea. Our therapeutics are designed to support and promote the body's ability to fix itself. Why? Because there's no simpler way to put it. Arthritis is a nutritional deficiency disease. You don't have arthritis because you have a bad gene. You don't have arthritis because you have a voodoo curse. You don't have arthritis because of the aging process. You have a bad joint because you have a bad doctor. It's that simple. $25 million of federally funded research done by my mentor, colleague, and friend, Dr. Joel Wallach, the founder of the Longevity Company, proved that there are 90 essential nutrients that the human body needs in order to function the way that God intended it to. 90 essential nutrients. Here's the breakdown. 60 minerals, 16 vitamins, 12 amino acids, and 2 essential fatty acids for a grand total of 90 nutrients. And if you hang out with us long enough, you will see this slogan everywhere. It's directly underneath me. 90 for life. That's what this refers to. The 90 essential nutrients that are necessary for life. By the way, a nutrient is considered essential if the body needs it but can't make it. Cholesterol is very, very, very important for your health. That's right, I said important. That's a whole nother webinar. There's no such thing as high cholesterol, for all intents and purposes. Cholesterol is your friend, but it's not an essential nutrient because the body can make it. Cholesterol is so important to your health, your body makes it. The 90 essential nutrients are necessary for health, but your body can't make them. So they must be imported into the body every day. They must go down the hatch every day. The only problem is, and it's a big problem, it is an overlooked problem. This is a billion-pound gorilla in the middle of the country that nobody sees. It is impossible to get all 90 essential nutrients from food. You can't do it. It's not just tricky. It's not just challenging. It's impossible. And here's why. 90 essential nutrients. The lion's share are minerals. 66%, 2/3 of your nutrient needs are minerals. Things like calcium, magnesium, sulfur, zinc, selenium. Only problem with minerals is the only person that can make a mineral is God. Plants can't make minerals. Animals can't make minerals. If a plant could make a mineral, we could bioengineer carrots to make gold, and we'd all be rich. Minerals are found in the soil, or not. Here's a map of a very important mineral for human health, selenium, in the U.S. Now, on this map, the legend, the pinkish and reddish colors, that's a lot of selenium there. Yellowish, you get not so much. Bluish, not so much. Gray, forget it. And if there's white, there is no selenium at all. Now, remember, this is just one mineral out of 60. There are 60 other maps, but they're all different. There's no place on the planet that we've discovered in the topsoil where all 60 minerals are found. It doesn't exist. It does not exist. So the only way selenium or calcium or zinc or sulfur gets into your body is if the roots of the plant that you're eating touched it when they were growing. Same goes for cow's milk. If a cow's eating grass that was grown in soil that was calcium deficient, the cow's milk is calcium deficient. Interestingly enough, ounce for ounce, there's more calcium in maple syrup than there is in cow's milk. Who knew? We knew. And that's why we do these webinars. Everybody needs to know this, and nobody does. Now, this isn't rocket science. If this tank, this drawing, represents your body's nutritional needs, right? In order for your body to be healthy and for everything to work the way that nature and God intended it to, your nutritional tank needs to be topped off every day with the 90 essential nutrients. Every day. But because nobody knows this, nobody supplements appropriately. And even if you have a perfect diet, you eat exactly the right stuff that you need to, and it's all organic, you can secure about 30–40% of your body's nutrient needs from food. But then you experience the stress of life. Emotional stress, financial stress, environmental stress, crap in the air, crap in the food, crap in the water, bugs, viruses, germs, lions and tigers and bears. Oh my. Guess what the stress does? It burns right through your reserves. Now you're running on fumes, baby. You know what happens when you run on fumes? Things start to break. Why, you think you got osteoporosis, which is thinning of the bones, because you have a bad gene? No. You get osteoporosis because for the last 30 years your body has been deficient in the stuff it needs to keep the bones healthy. And every day, unwittingly, you're eating food that's causing chronic low-grade inflammation to the joints because you listen to Dr. Oz tell you what to eat. Dr. Oz is a cardiac surgeon. You want to get Dr. Oz's advice, you should listen to him about what type of chest spreaders to use and what type of scalpel and which type of stitch is the best to close the chest cavity after the operation. But we've been socialized by 100 years of pharmaceutical profiteering propaganda to think that the MD has a secret decoder ring to all things medical just by virtue of their education, and they do not. Your medical doctor, bless his heart or her heart, may be the nicest human being in the world, but they have no education, no appreciation, no respect, and no understanding whatsoever about the relationship between medical nutrition and your health. And that oversight is killing you. The leading cause of death in the United States is MD-directed medical therapeutics. 780,000 people a year are killed by MD treatments. That's more people than are killed by heart disease or cancer. Leading cause of bankruptcy in the United States, MD therapeutics. Because the most expensive therapeutic is the one that doesn't work. So you don't have osteoporosis because you have a voodoo curse. You have osteoporosis because your body ran out of the stuff it needed to keep the bones healthy. So this is a cross-section of your spine. And the white stuff in this drawing is the bones, your backbones, the stuff the chiropractors adjust. We love chiropractors, by the way. The red tissue here is the cartilage cushion between the joints, between the bones. And the black, green, and purple stuff is the nerves. Okay? Now, when you're healthy, the red colored discs, they're not really red in life, but for artistic expression, right, they're red. Those discs are like feather pillows, and they're chock full of feathers. But as you go down the road of life, if you're not consuming the right nutrients, the bones and the discs run out of structural integrity, because you've stopped feeding them. So what's going to happen when the disc loses its structural integrity? The weight of your body is going to make it squish. It's going to flatten out like a pancake, and then it's going to touch the nerve that it should be protecting. You know what that translates to? Ouch! Pain, baby. And then some more pain. But the MDs have no earthly understanding about what causes this, and all they have for this is anti-inflammatories, pain meds, anti-inflammatories, pain meds, anti-inflammatories, pain meds, and don't dare go to those chiropractors. You got to be kidding me. Once again, I cannot stress enough, we do not have a free medical market in the free world. We do not. Access to medical information has been monopolized by the pharmaceutical industry for the last 100 years. You know, you've got garden variety arthritis, right? It hurts, man. Why do you have garden variety arthritis? Because your body's run out of the stuff it needs to maintain a healthy joint. Your skeleton is begging you for nutrients. But you don't know what you don't know. And when it comes to your bones and joints, it is a slow, steady slide into the land of pain and suffering, which the MDs are only too happy to address with expensive, dangerous, side effect-ridden treatments which have been proven and published to not work. And yet they roll them out and walk away with $500,000 a year. Sleep very soundly while you're still in pain. And this passes for the best medical system in the world? You've got to be kidding me. Well, you know, it's like the movie The Matrix. You know, everybody's wrong. Well, you know what? I'm the red pill. It's time to wake up. So, I cannot emphasize enough. In the context of my private practice in states in which I'm licensed and regulated as a physician, I can treat disease. In the context of my longevity business, in the context of my relationship with my longevity distributors, in the context of this webinar and most of the public webinars that I do, all of the webinars for Dr. Glidden Insiders, we do not treat disease. But what we do is recommend therapeutics, science-based, clinically verified, formulated and delivered by licensed physicians, the intention of which are to support and promote your bones and your joints' ability to fix themselves in this case. And that's what we're going to talk about next. How do we support and promote your body's ability to have healthy bones and joints? It's easier than falling off a potato truck. So let's break it down. The cartilage of your joints are made from glucosamine sulfate, chondroitin sulfate, and a funny little thing called hyaluronic acid. Say that 3 times fast. So guess what we do? If I've got weak ligaments, tendons, bones, or joints, I'm going to recommend supplements that are filled with glucosamine sulfate, chondroitin sulfate, and hyaluronic acid. Hallelujah, and pass the hat. This is it. It's glucogel. That's why it was developed. Now look, we don't really have enough time to get into the science behind this, right? But the fact of the matter is, not all nutritional supplements are created equal. Nutritional supplements are like wine. All wine is made from grapes. But there's a great deal of difference between Annie Boone Springs green apple wine and a nice California Pinot. Well, what's the difference? The recipe. I've been doing naturopathic medical therapeutics for a quarter of a century. My profession, members of my profession are the stewards of medical nutrition. This is our thing. This is our wheelhouse. And as God is my witness, I am here to tell you that in 25 years of clinical work, Dr. Wallach's nutritional supplements, like this one, glucogel, and this one, which is a liquid glucogel, are more effective than anything I've ever used. And by the way, I used to work for a nutritional supplement company that only sold to physicians. I've been around this block a lot. What it boils down to is science, recipe, and clinical effectiveness. Longevity on all three of those counts has a lock. This stuff was formulated from $25 million of federally funded research, 26,000 autopsies, and 10 million blood chemistries and histopathologies done by the founder of longevity, Dr. Joel Wallach. It doesn't get any better than this. But the only way that you're going to have any understanding that I'm not blowing smoke is to try it and see for yourself. Because the proof of this pudding is definitely in the eating. Now, you want to have a car that lasts for 200,000 miles? You're going to change the oil. You're going to put transmission fluid in it. You're going to put brake fluid in it. You're going to put power steering fluid in it. You're going to top everything off, right? For goodness sake, most of us take better care of our cars than we do of our bodies. But not because we're slackers, just because we don't know any better, because nobody's ever taught us, nobody's ever lined it up like this. Surgery is complicated. Healing is easy because your body knows how to fix itself. Your body wants to fix itself. So I have the easiest job in the world. Deliver unto your body the stuff it needs to fix itself. Stop eating stuff that's gumming up the works and get out of the way. This is the recipe to optimize joint function. Period. End of discussion. And I don't care if you have rheumatoid arthritis, osteoarthritis. It doesn't matter which subset of bone and joint trouble you have. It does not matter what the MDs have called it. This is what we recommend you do. Now, the last thing on this list, killer biotic, we only recommend if the diagnosis is rheumatoid arthritis. Because we believe that rheumatoid arthritis is nutrient deficiencies on top of a parasitic infection of the joint capsule by a little bug called a mycoplasma. If you have rheumatoid arthritis, we believe that there is a bug living in the joint capsule that's messing things up. So we support the immune system and hope that by doing so, the immune system will rally and kill the bug while we're delivering medical nutrition. So for every single bone and joint issue, we use Beyond Tangy Tangerine, liquid calcium, which is OsteoFX, Glucogel in the capsules or the liquid or both. Essential fatty acids, plant-derived minerals, for everything. For every different delineation of bone and joint trouble known to humankind now or in the future. And if there's a rheumatic or rheumatoid problem, we add killer biotic, and it's that simple. Now, one of the secrets to our success is not only the recipes, but the dosage. Now, does a tank need more oil than a Volkswagen? Yeah, yes, it does. Does somebody who's 300 pounds need more glucosamine sulfate and more calcium and more vitamin A than somebody who's 95 pounds? Yes, they do. So, we have developed Foundation Medical Nutrition boilerplate health recovery protocols, which are dosed in a perfect world based on your weight. That's why these delineations are like this. Now, you don't need to worry about doing all the math. If you're a guest, if somebody's brought you here tonight, and the information that I've given you has piqued your curiosity and you want to get started, they know how many bottles a month you need based upon your body weight, because it's easy math. We've got it all figured out. But the point that I want to make here right now is one of the reasons that we get such unbelievably remarkable success here is because we're the only ones in the world that dose medical nutrition health recovery strategies based upon your body weight. It's a very important distinction. Here's what the stuff looks like, by the way. That's a healthy bone and joint pack, plant-derived minerals, and killer biotic. You already saw what the liquid glucogel looks like. That's it. You've got unhealthy bones and joints. Guess what? This is the secret sauce to strengthen and support and promote your body's ability to have healthy bones and joints. And if you've been suffering with an arthritic condition, if you've been suffering with osteoporosis or any type of a bone and a joint problem for more than 3 months, most people are suffering with this stuff for years. They've gotten used to it. After you take this and you clean your diet up and your health improves, you're going to be filled with righteous indignation about the lost months, lost years that you've had because your MDs sold you a cock and bull story. The proof of the pudding is in the eating, ladies and gentlemen, and my people are destroyed by lack of knowledge. Feed your body. Feed it. Give your body the nutrition that it needs to have healthy bones and joints. Stop eating food that's gumming up the works. Get out of the way. Now, some people, because of religious reasons, can't do the glucogel because our glucogel is derived from shellfish. So, if for whatever reasons you can't eat animal products, then as a workaround for glucogel, we've got these two products, Z-Radical and Fucoid Z. Z-Radical is a liquid, Fucoid Z is a capsule. Both of these supplements contain a sea vegetable extract called fucoidin, and there are over 1,000 published studies on the positive effects of fucoidin, one of which is the stimulation of stem cell production. So if you still have stem cells in your joint, which you do, and you take fucoidin in sufficient amounts, chances are very good that your body will be stimulated to generate new cartilage tissue. And if anybody tells you that that's impossible, they're lying to you. We do it all of the time. Now, we're holistic, which means we don't just slap and dab. We don't just medicate symptoms. We don't just sweep things under the rug. It's a two-step program. Step number 1, nutrify your body. Fill up your tank. Appropriate for your body weight with the right stuff in the right recipes. Step number 2, stop swallowing stuff that's hurting your body. Now, I have done hour-long webinars just on this slide right here. Don't have time to do that tonight. There's a video, a free video on YouTube, circulating on YouTube, called Against the Grain, which explains why wheat, barley, rye, and oats are like death on a plate. After this webinar, just go to YouTube and do Dr. Glidden Against the Grain, and you can pull it up and watch it, and it will explain why the gluten in wheat, barley, rye, and oats is one of the worst foods for the human body. Long story short, wheat, barley, rye, and oats harm the small intestine. And the small intestine is the structure in the body, the organ in the body whose job is to absorb nutrition into the bloodstream. It's not a good idea to damage that. But every time you eat a whole wheat sandwich or pasta, you're damaging your small intestinal tract. Who knew? By the way, who told you to eat that stuff? Monsanto, General Mills, Betty Crocker, who wasn't even a real person. Stop it. Bad dog. No biscuit. Oil in a bottle is also one of the worst foods a human being can consume. Oil in a bottle is loaded with free radicals. Free radicals promote inflammation in the body, period. If you heat an oil, the free radical production goes ballistic. I don't even want you to be downwind of fried food. That's how bad it is. Well done red meat contains a carcinogenic substance called a heterocyclic amine, and it will hurt you. It's not present as much in rare red meat or meat that's stewed or put in soups or in a crock pot. So you want to have a steak. I just had one last night, by the way. Have it rare or medium rare. No grill marks. Because all that charred meat is heterocyclic amines, and that crap will kill you. Nitrates added as preservatives to bacon, salami, sausage, turkey, deli ham converts into a carcinogenic substance called a nitrosamine, which causes cancer. Not a good idea. Now, you want to have bacon, sausage, ham, pepperoni, no problemo. Just make sure it doesn't have nitrates in it. Period. The skins of baked potatoes, yams, and sweet potatoes, how about that? The crunchy skins, you know, when it's really yummy, that's also loaded with heterocyclic amines. It's death on a plate. You want to boil a potato, a yam, or a sweet potato? Be my guest, you can eat as much of that as you want, because it's only the baking process that makes the chemical convert into a heterocyclic amine. A carbonated drink drunk with a meal neutralizes stomach acid. The little fizzy bubbles, it's carbon dioxide. Carbon dioxide neutralizes stomach acid. When you're healthy, your stomach acid is so strong that if you chopped your finger off and swallowed it, your stomach would digest it down to the bone. Your body wants and needs to have strong stomach acid, but when you wash down lunch or dinner with a Coke or a Perrier or a beer or anything that's got bubbles in it, you're inhibiting digestion, and you're going to die, sucker. But you're going to die slowly. So you want to have a carbonated drink, have it between meals, not with a meal. Now, just in this one slide, assuming, of course, I'm correct, which I am, the information on this one slide will save your life. And inquiring minds want to know, why don't you know this? Because we don't have a free medical market? Because your medical doctor may be the nicest human being in the world, but they have no training, no respect, no appreciation, and no understanding of medical nutrition. Zero! You know what we're like? We're like the people years ago that said, hey, everybody, it's a good idea to purify the water, not to pee upstream and drink downstream. And by the way, we have to have a good public sanitation deal going on. We need clean water, and we need a way to eliminate our waste so it doesn't hurt us. Just by doing those two things, historically, human life expectancy doubled. Well, the information that I'm talking about tonight, the information that Dr. Wallach's been talking about for 20 years, the information that Longevity Nation champions every day, has this potential. I mean, think about it. Everybody all of the time is eating food that's hurting them. All of the time. And everybody's nutritional tank is running on fumes. So something breaks. And you go to the allopathic MD who doesn't believe your body can fix itself. And what do? They throw a drug at it. And so we die slowly. Well, guess what? There's a new sheriff in town. There's a new way. And it's our way. Now, because nobody knows this, and everybody needs to, Dr. Wallach set Longevity up on purpose as a networked marketing company. On purpose. In order to grow and populate a grassroots coalition. So I tell you, you tell somebody, they tell somebody, they tell somebody, yada, yada, yada. That's how it goes. Worked pretty good for the church, by the way. Started with 2 guys. Look at it now. All word of mouth. There are 2 ways you can interface with Longevity. You can interface with us as a customer. You can tell us what your complaints are, and we'll tell you what we recommend to support and promote the structure and function of that part of your body. And we'll sell you the stuff at the wholesale price. Not bad. Now, if you're feeling a little deficient in vitamin M, if there's more rent left at the end of the month than there is money, if you need a little financial salvation, then we can help. You can join Longevity as a business builder, and as a business builder, as a member of Longevity, we will pay you handsomely to promote our message of health recovery through science-based, clinically verified medical nutrition. And that beats a poke in the eye with a sharp stick, because what are you doing? You're helping people to have a better quality of life. with science-based, clinically verified, pragmatic, and effective treatments that actually work. Now, people don't like it when I do this, but I'm going to do it anyway. Remember, it's all about the numbers. 46 million people in North America with arthritis. If you were able to reach 0.1% of those people, 0.1% of those people, that's 4,600 people. So you get into Youngevity, you give us $10 as a membership fee, $10, one time only. We show you how to show this message to people in a way that attracts them to you. We show you how to be a good Youngevity network marketer. We teach you how to be an upstanding member of the community. We teach you to be someone whom your neighbors will come to love and respect. And you show what we're up to any and all. And then you got other people who want to help you and build the business, and they show it to any and all. And after a couple of years of doing this, your organization has reached 4,600 people with arthritis, 0.1%. You've joined Youngevity for $10. The average Healthy Start Pack for bone and joint health recovery is about $250. As a Youngevity member, you secure about 8% of that every month, every time somebody buys. You know what that translates to? $90,000 a month. Now look, would $90,000 a month make a difference to you? Would that make a difference in your lifestyle? And would you sleep better at night knowing that you were able to make that much money by helping people, not by cheating people? By actually helping people to have a better quality of life? Would you sleep soundly that night? Now look, this is an extreme example, right? Which is why everybody hates it when I do it. But I don't care. Because I'm playing a big game here. I'm playing a big game. There was somebody at Timmy Hortons yesterday. There was somebody at Starbucks. There was somebody pumping gas right next to you last week who went to bed the night before praying to God for help. Because conventional medicine has let us down. They've let us down hard, and people don't know what to do. If you help us spread our message, there is no limit to how many people you can help. And remember, armies need to be paid, right? Well, guess what? This is a non-militant grassroots coalition of the informed. People who've taken it upon themselves, the business of humanity. You don't know what you're missing, ladies and gentlemen. Youngevity is here for the long haul. If you're a guest, get with the person that invited you here tonight. See how it is you can work with us. You work with us as a customer. Fantastic. Give the stuff a try. Clean your diet up. Nutrify your body. Take back your health. If you need a little extra cash, you know, a couple of $100 a month, great. $1,000 a month, great. We'll show you how to do it. We're on a mission to help lift people up. And in this business, a rising tide lifts all boats. Ladies and gentlemen, I'm Dr. Peter Glidden. Thanks again for your time. Especially if you're a guest here, I really do appreciate it, because you didn't know me from Adam, right? You trusted the person who brought you here. I hope I haven't disappointed. If you like what I'm talking about in tonight's webinar, I have a radio show Monday through Friday. You can listen to it all around the world on the internet from 3 to 5 Central. Get with the person that invited you here tonight and see how it is you can work with us. I look forward to meeting you in person at some time in the future, and until I do, I will remain your steadfast advocate for health, Dr. Peter Glidden, hoping that you live long and prosper. See you all around campus. Thanks again for your time.